when people run the air conditioning, they close the windows, and that creates conditions where there's not enough fresh air and ventilation moving through through these indoor spaces. What the experts say that I spoke to is that it's possible that the virus, the viral load is building up in the air in those indoor spaces and fueling transmission. And so Europe has the advantage that people can go to restaurants and sit inside in restaurants with the windows and doors wide open because the summers are relatively mild here. And so this is going to be a problem, I think, in the United States over the summer, where large parts of the country do absolutely need air conditioning for you to be inside. And people are talking about, well, maybe we need to change the settings on air conditioning to facilitate having more fresh air, because most air conditioning systems, they recycle most or all of the air to save energy costs. And so that really creates a situation where you're just not getting enough ventilation through spaces where there are a lot of people occupying the space. And that's the problem.
Short, do you agree air conditioning kills?
I don't think it's really about air conditioning. As was just said, I think it's really about indoor spaces versus outdoor spaces. And what we're seeing is that the risk of transmission in outdoor spaces is quite low. And we've seen this all play out with the Black Lives Matter movement, that actually there's been a limited number of cases that have been traced back to those protests. And probably the saving grace of those protests is the fact that they were outside. So this really tells us a lot about viral spread, but it also gives us some useful information about how to reduce the risk of spread if you do have to meet with an individual face-to-face.
Linda Ball, do you remember that hot day 10 days ago when everybody went to the beach in Bournemouth in southern England? What's happened since? It's too early to tell?
Yeah, very little. I mean, that might be too early to tell, but it's not too early, Francois, to think back to VE Day, for example, in the UK, when there were street parties and other gatherings. That's way back many weeks ago. We've definitely, as Kirsty's saying, we've not seen rises that we can link back to outdoor social gatherings or outdoor protests. And I think it absolutely is the case. It's because they're outdoors. But of course, what we're going to see as we go into the autumn and winter months in the UK, as we were just hearing, we can open the windows now in restaurants and bars when they reopen. They're not open yet in Scotland. But as things get colder, we're going to be more indoors with windows closed, trying to keep warm. And that is a real concern in terms of future spikes here in this country.
Does that mean we have to just sit tight and wait for that eventual vaccine that may or may not work?
Well, I think all of us are waiting for two things, and the scientific community is working at speed, and funders are contributing significant resources to better treatments. And of course, we've seen one already licensed. And secondly, a vaccine potentially. We're very uncertain about that still. But no, we can't just wait for those. We have to live alongside the virus. And that's why the public health response, the test, trace, isolate, the giving guidance to people, including on the risks associated with different environments, the social or physical distancing, those are the things we just must implement until science helps us out with some of the bigger questions.